Hi, this is Dr. Vijay, Senior Consultant Cardiac Surgeon from Staff and Acute Heart Center at Visakhapatnam. Today, let's speak about heart healthy living conditions. So, what is a heart healthy living condition? To assess a healthy heart, one needs to understand what is the basic characteristic that the heart fulfills for a human being. So, you need to understand what are the conditions or pre-existing disorders that can give you an abnormal heart. Now, there are many conditions which can cause abnormality in the heart. These can be divided into two groups, basically for understanding of the common people. One is called as the modifiable risk factors. The other one will be non-modifiable risk factors. Now, whenever we are born with the inheritance of basic genetic material. These fall into what are called as non-modifiable risk factors and inherited family disorders which predispose to abnormal heart development or heart condition are non-modifiable. These are some of the conditions which will result in abnormal heart valves or occurrence of blockages in the coronary arteries earlier in age. Apart from these, a person's sex is also a non-modifiable risk factor. The next non-modifiable risk factor is the sex of the person. Among the two sexes, the females, the prettier sex are actually protected because of their hormonal development, and hence the cardiac abnormalities are less commonly seen among them. Generally, among the reproductive age group, females are protected from cardiac problems because of the hormones. Once they attain menopause, the risk factors, the risk simulation are almost similar to men. Age of a person also forms a non-modifiable risk factor. As the person becomes elderly, with age, there are certain cardiac abnormalities that can generally develop. So these are three main non-modifiable risk factors which are inherent to any cardiac problems, and these cannot be modified in any way. Apart from these, the major modifiable risk factors are what we are dealing with and what can be actually in our hands can be modified to attain a better and healthy heart. Among these, if you know the conditions, if you know these risk factors, these are the factors that can be corrected, modified and prevented to achieve a normal healthy heart. So let's talk about these factors one by one. If a person has any of these risk factors, it means his probability of getting a cardiac problem is much higher. The more number of risk factors that he has, the more the chances of developing a cardiac problem. A person who has high blood pressure, abnormal cholesterol levels, higher cholesterol levels, a person who has lack of physical activity, a person who has habits such as smoking, especially cigarette, which is in the form of any form, tobacco in any form, alcohol consumption, absence of physical activity, all these are risk factors which incrementally add on to developing a cardiac problem. Any one of these conditions, any one of these problems can itself predispose to developing a cardiac problem. When these simultaneously coexist, the probability of that person individual getting a cardiac problem is much higher. Generally, when we evaluate a patient who comes with a cardiac problem with any of these predisposing factors, we generally suggest them a few cardiac tests that can be evaluated to assess the function of the heart and also if there are any problems. Generally, any person who has any of these risk factors at the age of 35 years for a male and at the age of 40 years for a female require an initial basic evaluation which includes a series of blood tests, series of cardiac tests like an ECG or a basic echocardiogram, and if warranted, something like a CT cardiac casual scoring. Subsequent tests are decided by a specialist which includes a cardiologist or a cardiac surgeon to evaluate a person if the person is having a cardiac problem or not. In a person who does not have any of these risk factors, the need for any of the further evaluation of these tests is decided by the attending physician or the cardiologist at the point of presentation of this person. Thank you.